Welcome to Medical Massage Therapy. I'm Sam Small. I've worked with David Marin and Juanita Thompson for many years to create an online masterclass in medical massage. I'm a video producer and a course educator. David and Juanita have gracefully retired. We're so happy for them. And moving on, I'm thrilled to be able to introduce Barbara Ollis and Julie Brown, who are coming on board to be able to continue offering these wonderful, wonderful courses in medical massage. Relaxing massage is a wonderful, wonderful thing. The client is always the nervous system. And if the nervous system needs just simply that relaxation, spa type massage, fluffing and making nice, that's perfectly fine. And massage can do so much more in a clinical setting with a focused perspective on what the client's specific pains, injuries, and conditions are. And this program is dedicated towards preparing you to be able to apply that entire clinical protocol to each and every individual client that walks in your door. So, Barbara, how did you fall into this clinical paradigm?
Well, I've been in healthcare for more years than I'd like to admit. I started working for chiropractors when I was 16. It was Swedish massage. And like you said, it does feel good, but working with chiropractors, they're very much intent on cause and effect. And I really like to get to the cause of problems. And I knew that Swedish massage was not what I was looking for. So while I was in massage school, I found the St. John neuromuscular methods. Mm-hmm. And this was back in the 90s. And I was doing that while I was in massage school.
At the same time. So you were fully immersed in just jumping into this.
Up to my eyeballs. Yes. I had a complete insurance pretty much practice for many years. Got a lot of referrals from medical doctors, wrote a lot of reports, did a lot of clinical massage that was very effective with the neuromuscular. And, you know, David was a neuromuscular therapist before he started with his own technique. Part of it was because he blew his thumbs out, which happens with men because they do too much pressure often. Yes. And, you know, they hurt themselves. So he started this to be able to give himself some treatment options, which is certainly with no thumbs, that is definitely an option. Many therapists ruin their thumbs quickly by doing too much pressure and doing it improperly. And the clothes on, my insurance practice was pretty much clothes on. I put them in tube tops and shorts. So I still had enough to, if I needed to get to skin, I could move it around, but it was not a whole lot of draping. I could get them up. I could put them back down. I could do most anything with them because they were covered. So that's what I did for many years. I have a half and half practice now. I still do clinical massage. I've been in practice now for 30 years. So I have many old people, many people older than me, and they really like the soothing massage. And then I have some that I use the clinical massage on too. So I have a mixture of both.
You know, it's fascinating because you adopted this early on into the whole process. Yes. And that's wonderful. And Julie actually has a similar story. You started really young, didn't you, Julie?
I did. I signed up for school when I was in high school because I wanted to be a doctor. I was kind of obsessed with, in fact, on my spare time, I would literally read medical terminology books. I didn't really like the spa stuff. I didn't really like the idea of just rubbing oil on people and giving a relaxing massage. Although, of course, we all do a fair share of that. So right away, I actually was in the mix with Barbara and David doing neuromuscular therapy, working with doctors. And I actually decided not to be a doctor, getting into massage as a business and as a profession. I liked spending more time with people. I liked the whole idea of assessing and treating and building this relationship and their wellness where you're seeing someone for many years and for a longer session than the 5 minutes the doctor would spend with you. And then in my own personal life, massage has been amazing in my own health issues So yeah, just the medical aspect, the clinical aspect of massage, I've always been obsessed with. I've always been a student of. So this curriculum, the neuromuscular base that David's put this through, it's not unfamiliar to me, and it fits perfectly with the education that I have to be able to offer this same education.
We're certainly happy to have you. I come to this as a client because I've had 4 neck surgeries, disc replacements, and enormous amounts of locking up of my scalenes, and searched really hard for trigger point acupuncture and massage therapists who could, who understood. And I moved to Maui, and I was introduced just casually to David Marin. And I had a session with him, and it was, I cried. He understood what I was going through and was able to make a difference for me. And so few therapists were able to do that. And I just recognized that was a very, very special and a very, very important skill set. And that David was a teacher and I'm an education producer. And it was just a match made in heaven to be able to take David's entire curriculum, 40 years, he and Juanita, 40 years of putting together, finding everything that works and putting it together in a package with the entire clinical environment of assessments and record keeping and keeping track, Julie, like you said, working with people over time for their well-being. That's the best application in my mind for these skills. And that's what these programs are really all about. It's an entire package of clinical, medical massage, whichever you want to call it. That's what this whole program is dedicated towards, being able to give you as a therapist so that you can do what Barbara does, you can do what Julie does, you can do what David and Juanita have been doing for all these years, and have a significant impact on your clients and relationships as a community caregiver, as a healer within your community.